Signs you may have polycystic ovary syndrome. A common women's hormonal disorder, polycystic ovary syndrome, or is the most common hormonal imbalance for teens and women of childbearing age. Almost 1 in 10 women has PCOS. But more than half of women with PCOS don't know they have it, according to the PCOS Foundation. If you have 2 or more of these signs, see your doctor to discuss the possibility of PCOS. The sooner you treat the symptoms of PCOS, the sooner you'll feel better. Irregular periods. One of the hallmark symptoms of PCOS is having irregular periods. This could mean never or rarely having a period. You could have a period at varying intervals, such as after 20 days, then after 35 days, and then after 16 days. You may experience bleeding or spotting between periods. Or you may have especially heavy or light bleeding. Hormonal birth control, such as the pill or the vaginal ring, can help with irregular periods when you have PCOS. Infertility. 1 in 5 women who experience difficulty becoming pregnant has PCOS. This makes PCOS the most common cause of infertility, according to the U.S. Office of Women's Health. PCOS tends to cause high levels of androgen hormones, such as testosterone. Excessive amounts of androgen can prevent your ovaries from releasing an egg, ovulation. If you haven't conceived after trying to become pregnant for 12 months or for 6 months if you're older than 35, the culprit could be PCOS. Weight gain. Another common symptom of PCOS is extra weight. Women with PCOS may experience weight gain, even though they haven't been eating more or exercising less. Or they may try to lose weight, but have a hard time. Women with PCOS also tend to have extra weight around the waist. If you notice any of these weight problems, talk with your doctor about whether PCOS could be contributing to them. Extra body and facial hair. Hirsutism, extra growth of dark or coarse hair on the body or face, is a symptom of PCOS. Androgen hormones, which are responsible for male sex characteristics, are the cause. Females produce a small amount of androgens, but women with PCOS often have high levels. Hirsutism due to PCOS can appear on the upper lip, cheeks, chin, top of the arms, inner thighs, lower belly, breasts, and lower back. Less often, it can show up on the chest, upper back, and upper abdomen. Thinning scalp hair. A less common, but still notable and upsetting, effect of PCOS is alopecia, thinning scalp hair. It may look like you're losing hair in the same pattern some men do on the top of your scalp, toward your forehead, or at your temples. Or your hair may appear thinner all over your head. There are several other possible causes of thinning head hair in women, such as diet, other endocrine disorders, such as hypothyroidism, stress, and infection. Persistent acne. Women of all ages from the teen years onward experience pimples, clogged pores, and oily skin. But PCOS can cause you to have these symptoms all the time, no matter what treatments you try. Creams, toners, and antibiotic pills often don't help acne when you have PCOS. Birth control pills can help treat acne from PCOS by balancing your hormones. Dark skin patches. PCOS can also cause you to have patches or darker, velvety-looking skin called acanthosis nigricans on certain areas of your body. Acanthosis nigricans are harmless, but can be cosmetically unpleasant. It most often occurs in the groin, under the breasts, in the armpits, and at the back of the neck. Insulin resistance from PCOS is the usual cause. The good news is treating the insulin resistance and balancing your hormones can help clear this skin condition. Skin tags. Skin tags are a less common PCOS symptom, but they can occur. Skin tags are small, flexible bumps or flaps of skin. Skin tags due to PCOS typically appear on the same areas as dark skin patches, acanthosis nigricans, in or near the back of the neck, under the breasts, in the armpits, and in the groin. If skin tags are bothersome, see a dermatologist to discuss removing them. Pelvic pain. Pelvic pain is a less common symptom of PCOS. But PCOS can produce ovarian cysts, which themselves can cause pain in the pelvic area. When ovarian cysts cause pelvic pain, it can feel like a dull ache or a sharp jolt in your lower belly. You may always feel the pain, or it may come and go. There are many other causes of pelvic pain, including ovulation, endometriosis, and uterine fibroids. See your doctor for proper evaluation of any type of pelvic pain. Depression and anxiety. Women with PCOS have significantly higher rates of depression and anxiety than women without PCOS. Depression can produce feelings of sadness, hopelessness, fatigue, and irritability. Other symptoms include physical pain, irregular sleep, difficulty concentrating, and digestive problems. Anxiety can make you feel constantly worried, as well as irritable, fatigued, and restless. If you have these symptoms, it's important to see a doctor for treatment regardless of the cause. With help, you can get back to feeling like yourself. Whether you have these symptoms or not, anytime you have questions or concerns about your PCOS is a good time to see your doctor. He or she can talk to you more about your symptoms and what you can do to improve them.